We start with inspecting the head, and when we're inspecting the head, we start by feeling the shape of the head to see if there's a depression in the skull, or is there any mass protruding, or any unusual signs and symptoms of trauma to the head. So his head is firm. There's no soft area or hard area. There's no depression, normal occiput. The hair distribution is even. There's no balding spot. I don't see any redness or any rashes to the face, to the neck area or ears area. Also, this is the time to inspect the facial features. If there's any facial drooping, any facial asymmetry, or is there any involuntary facial movement. So the next thing that I'm going to be doing will be palpating the temporal lobe and check for the temporal arteries. You have to make sure that you have to take note that you shouldn't be feeling a temporal artery that's very hard. That's not a good indication, and it could be possibly an emergency situation. Also, going below is your temporal mandibular joint. I will need you to open your mouth, and then one more. Open, one more. Do you have any pain in there?
No.
All right. So after that, I'm going to be checking for the sinuses. So we'll be checking for the frontal sinus, and do you feel any tenderness?
No.
And then the maxilla sinus, do you feel any tenderness?
No.
All right, so after assessing that, we will proceed with assessment of the eyes. So in assessing for the eye, you use inspection as your first tool. So you'd like to see the appearance of the eyes when you're inspecting it. Make sure that there's no crusting in the eyebrows, or there's no crusting in the eyelashes. So you also check for the sclera. Can you go look up? I'm gonna hold this down really quick. Make sure they're pink and moist, and the sclera is clear. So there's no jaundice. I don't see any jaundice in his eyes. Also using my pen light, I'm going to check if there's any foreign object. None. And then also to make sure that both eyes, both pupils react to light equally, and with direct or indirect light. So his pupil is round, they're equal, and they react to light. Follow my hand in 6 points, but not using your head, just your eyes, okay? So up, down, up, down, up, down. Okay, now I need to do this. All right. And then, so that was testing for the oculomotor of the eye, which is the cranial nerve 3. So now I'm going to check for your peripheral vision, okay? Let me know if you can see my hand. Just there, look at my nose, and just tell me when you see my hand.
I can see your hand.
Okay. Opposite.
I can see your hand.
Okay, so peripheral vision is intact. Okay, so the next thing that we're gonna do, we will be assessing your ears, okay? So for your ears, the first thing that I will do will be the same thing. I will be inspecting your ears to make sure that there's no any visible deformities you can note, any redness, any swelling. So the first thing that I would do is do the pull test, tag test. So I'm gonna gently tag your ears, and you let me know if there's any pain, okay? Do you feel any pain?
No.
Tenderness?
No.
Okay, so normally once you try to feel and tag and pull it back a little bit, and they feel some pain, then you know that something is wrong. Okay, so I'm going to do the whisper test. I'm going to cover your ears, and then I'm going to whisper a word, and I need you to repeat it, okay?
Okay. Apple.
All right, I'm going to do the same thing right here.
Baseball.
All right, good. Both are intact. So now, in testing for the hearing, we're using the tuning fork, which we use for Weber's test and also for Ryan's test. So Jacob, I will be using this, and this is a tuning fork. It helps in the conduction of sounds and air in the bone, okay? So I'm going to strike it and then put it right here. Where do you hear it? The left or the right?
Left.
Do you hear it on the right too?
Yeah.
So you hear both sides?
Yeah.
All right. Okay, so I'm gonna do the same thing right here. Put it at the back of your ears. Let me know if you can hear it and when you stop hearing it.
You hear it?
Is it still there?
Yeah.
Let me know when it's done.
Still.
Okay, can you hear this?
Yeah.
All right, so I'm gonna do the same thing on the other. So let me know when you don't
Okay,
hear
yeah.
it anymore, okay?
Okay.
You hear it still?
I don't hear.
Okay, how about this? Okay. So that would indicate if he's not able to hear on both sides, and or if more leaning on the other side of the ears, there could be some conductive hearing loss. I will be asking you to close your eyes, and I'm going to put this thing on each side of your nose. I need you to cover each nose as well. Okay, and you let me know what you smell. What's this?
Orange.
All right, and cover the other side. Don't smell too hard, okay?
Okay. Coffee.
All right. So when you're testing for smell, you're also testing for patency. So that's just two assessments in one. All right. The next one would be using your otoscope. Again, I will have to pretend that this otoscope is working. And then you would like to just touch the nose to make sure that there's no swelling, there's no deformities, there's no broken bone or anything. And I will put this in, okay? I'm going to check for the mucosa. Nasal mucosa is pink. The turbinates are intact, and there's no swelling. There's no septal deviation, and there's no unusual discharges. All right, so the next thing that I would be doing would be conducting, I'm going to palpate for his lymph nodes. So the lymph nodes are located all over the face, and I will start at the back, which is the occipital lymph node. They shouldn't be palpable. And then we assess for the preocular and the post-auricular, pre-auricular, and then post-auricular, the tonsillar, and the submandibular, and then the submental. So we also would like to assess for the anterior cervical nodes right here and the posterior cervical node. We also would like to check for the supraclavicular lymph node right here. And now we're going to check for the neck area. So the neck, the trachea is midline. Visualization of your the thyroid gland. The thyroid gland is located normally below the Adam's apple, which is this is his Adam apple, and this is his thyroid gland, which is not swollen. And I'm going to assess for your trachea, okay? All right, can you swallow for me? All right, one more. Okay, I can see the peristalsis on the movement, and also I can feel the thyroid right here. There's no swelling. Can you swallow one more? All right. Okay. So, do you have any problem with your neck? Do you have any pain?
So I'm going to start off with having the patient cover her left eye. Okay, and I'm going to take my fingers.
4.
Now.
Now 4.
Okay, take my finger.
Now 4.
Okay, take my fingers.
Now 4.
Okay, so that was the left eye. I'm going to now have her cover her right eye.
Now 1. Now 1. Now 2. Now 2. Now 1. Now 3.
Okay, that was the visual field confrontation test. The patient was able to tell me how many fingers I was holding up and when she was able to visualize them. And all the patient looked directly at my pen light without moving her head. And I'm going to ask her to follow the actions of my pen light. So I'm going to ask you to look directly at the wall first so I can dilate the pupil. Okay, and then I am going to have you cover your left eye. Without moving your head, I would like you to follow the pen light, okay? Okay, I have tested the left eye in all 6 regions. Now we'll move over to the right eye. Can you cover your right eye, please?
Yes.
Okay, can you see the pen light?
Yes.
I'm going to have you look directly at the wall first. And can you see the pen light?
Yes.
Okay, so I'm going to have you follow without moving your head, please. So. Okay, very good. Now the patient was able to follow the pen light with both her left and her right eye. That was extraocular movement with cranial nerve 3, 4, and 6. I didn't see any involuntary nickness. I did not see any involuntary moving or ticking. So I did not see any nystagmus. Now I will perform a conversion and accommodation test. So with the conversion test, I would also take the pen light. Now move it in closer to the patient's face, in which I can see if the eyes are deviating in any way. So I'm going to take the pen light. I'm going to have her stare at the wall again. And then I'm going to bring the pen light closer and closer, 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 closer. And I see the deviation of the eyes at about 6 centimeters. The normal for conversion is 6 to 10 centimeters, and the patient was right about 6 centimeters, which is normal. Now we'll do the accommodation test. Now the accommodation test involves, as I move the object in closer to the eyes, it will constrict, and I move it further away, it will dilate. This is called the conversion test. So I will take the pen light. Then I will move it in closer, 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 closer. I see the eyes are constricting, And as I move it further, I see the eyes are dilating. That is called the Accommodation Test. So now I will perform the direct and consensual pen light test. This would involve me taking my pen light and shining in the patient's eye. That way I can watch the pupil as they constrict. I have a number system on my pen light, so I'll be able to see the millimeter of pupil size. Turn my light on, it is working fine, and I'm going to get started on that part of the exam. So I'm going to take this light and I'll be shining it in your eye, okay? So I will start off in the left eye. So I will take the pen light and I'll bring it inwards, watching the pupil as they, okay, take it out, bring it in, okay. I see that the pupil, it went from 3 centimeters to 1 centimeter, and the pupil size was 3 millimeters. Okay, gonna do it again in the other eye. Okay, so moving in. Okay, good. Out. Then move it in again, and then out. Okay. Also, I see that the pupil size also changed. So it is normal to see the pupil go from the 3 millimeters to a smaller size, and then as the light moves away, come back into the regular size. So that was 3 millimeters according to my dial. That is the normal pupil size. So as I turn this on, I'm going to start off and I'm going to look into the patient's eye. I'm going to move closer. I see the cornea, I see the lens, I see the red reflex. I'm moving in closer. I am following it down to the yellow-orange structure. I see the yellow-orange structure. I see the optic disc. The optic disc is intact. The margins are sharp. I don't see any AV nicking. I don't see any cottonwood spots. And I'm following down to the vessels. I don't see any hemorrhage. And the optic disc ratio is 1/3. Okay. And I will do the same for the other eye. Again, the light is nice and rounded so I can be able to visualize. And I am going to start, I'm going to take my right hand and I'm going to look at the patient's right eye. Do that again. So this is right eye over there, right? So I'm going to look at the right eye again. I am going to be following in. I see the cornea, I see the lens. I see the red reflex. Following the red reflex, I see the yellow-orange structure. I am locating the optic disc. I see the optic disc. The optic disc, the margins are sharp and it's intact. I don't see any AV nicking. I don't see any cottonwood spots. And I visualize the vessels. The ratio on the optic disc is 1/3. And the vessels, they're no hemorrhage noted. Okay. Now I am going to take my left hand and I am going to look at the patient's left eye. Use my hand. I'm going to brace it for safety so we don't bump into each other. Again, turn the light on, coming in at a 15-degree angle. Leave your eye open. I see the cornea. I see the lens. I am following in. I see the red reflex. Following the red reflex, I see the yellow-orange structure. Following it in, I see the optic disc. The optic disc is intact. The margins are sharp. I don't see any AV nicking. I don't see any cottonwood spots. I am following it down to the vessels. I don't see any hemorrhaging. The optic disc ratio is 1/3. Okay, and that concludes our part of the eye examination. Checking the spinal accessory straight. So go ahead and shrug your shoulders up. Okay, and don't let me press them down. Okay, this is good resistance against the shoulders, so I'm going to have you relax them back. I'm gonna take my hand, don't let me push your face, very good. Take my other hand, don't let me push your face, very good. So good strength and good resistance. So now I will be palpating the lymph nodes of the neck. I will start at the pre-oculicular, which is in front of the ears, the post-oculicular, which is behind the ears. I'll be palpating the submandibular. Okay, very good. The submental, very good. Then I will be palpating the pre-cervical, which is in front of the neck, and then the post-cervical, which is further down. I will also do the subclavicular, which is in between the little neck down here, and I don't palpate any masses or
Capillary
any
refill
abnormal.
on 10 fingers and any clubbing. Very good. And then your thumbs, please. Capillary refill is less than 3, which is normal. Okay, put my stethoscope. Okay, now I'm going to listen to her lungs posteriorly. Okay. First, I'm going to, you can just sit forward a little bit. Yep. I'm going to actually palpate your back. If you feel any pain, let me know. Can you turn the other way? Can you turn this way? Yeah. Okay. I'm going to palpate her. If you feel any pain, let me know. Mm-hmm. And this way. This way. This way. No pain?
No pain.
Okay. And if you stay like that, I'm going to just listen to your lungs.
Mm-hmm.
And you don't want to go over any bony prominence because you will not hear anything. So I'm going to start. I'm going to have you take a couple deep breaths. Her lung sounds are clear posteriorly, no crackles or wheezes or stridor. And now I'm going to assess her anterior. You can sit back. Okay, I'm going to do the same thing and palpate the front. If you feel any pain, let me know. Great. No. Okay.
No pain.
Great.
No pain.
Now I'm going to listen to your lungs again, and we're going to take a couple of deep breaths.
Okay.
Again, don't go on over any bony prominences. You won't hear anything. And one more. Anteriorly, her lungs are clear. There's no crackles, wheezes, or stridor. Great. And now I'm going to have you lay back a little because I'm going to check your jugular vein distension.
Okay.
You're going to go this way?
Yep.
You can even use that if you want. That's fine. Both of them. Okay.
I don't think you can see it.
Okay. Come up on the pillow a little more, this one.
Okay.
Okay, so we're going to do this? Yep. That's great. You can just lay back a little on 40. I'm going to have you turn your neck to one side. We're checking for JVD. Okay, and turn your head the other way. And we're checking for JVD, and there's no JVD present. Okay, and now I'm going to check your bowel sounds. Yep. Looking at her stomach, inspecting it, there's no distension. I'm actually going to listen and then palpate. And if you have 5 to 30 clicks, it's normal bowel sounds. If you have 5 to less, it's hypo. And if you have less than 5, you have no bowel sounds. You have to listen to the bowels, your bowels for 5 minutes straight. And normally you should listen to it for at least a minute. Okay, here we go. She had 27 clicks, which is normal bowel sounds. And now I'm going to listen to the other quadrants. And then we go to the right upper quadrant. And the left upper quadrant. And the left lower quadrant. She has active bowel sounds. Now I'm just going to palpate. If you feel any pain, let me know when I'm pressing. No pain?
No.
No pain?
No.
No pain?
No.
No pain.
No.
Great. It's like you're driving a car.
Now we're gonna.
Her strength is good. I'm going to check her dorsopedialis pulses on top. And they are present. And I'm going to check her posterior tibial. And those pulses are present and strong. Now I'm going to check her capillary refill and on her 10 toes. 1. Oh, we don't have any more toes. Capillary refill is less than 3. And now I'm going to check her, actually I'm going to have you lift your leg up and the other one. Very good. Her range of motion is good. I'm going to actually check her, oh Jesus, her capillary, her edema, see if she has any fluid retention with her nice friggin' lungs. And you press down, and if there's pitting of 1, it's 2 centimeters. 2 plus is 4 centimeters. 3 plus is 6 centimeters. And you go all the way up to the knee. And you do it on the other side as well. There is no capillary refill. There is no edema present.